So infertility based on Western medicine, just to look at it from an age standpoint, if you're a female under 35 years old, you would be considered having infertility problems if you have been actively trying for a year and have not conceived. If you're over 35 years old, it would be actively trying for 6 months and not conceiving. And then also in that category is recurrent miscarriages or not being able to retain a pregnancy. So, in the United States right now, it's quite amazing. 9 million people are having trouble conceiving. And it could be either you or someone you know. The chances of that happening is 1 in 8. So statistically, when you're looking at, how much of this is a female factor, how much of this is a male factor, how much of this is unexplained, the statistics show that 35 to 45% of all cases are due to female fertility problems. 15 to 35% are due to male, and 15 to 25% are due to a combination of male and female issues. So the female might have an issue with growing follicles or implantation. The male might have an issue with their sperm quality, the way it moves, or the amount he has. And then 10 to 20% of all cases are identified as unexplained. So they really aren't finding an answer as to why these two people can't become pregnant. That the female's healthy, the male is healthy, there's just no answer. And that is a lot of times when people might move on to acupuncture, Chinese herbs, assisted reproductive technology like artificial insemination, in vitro fertilization. I've seen many patients get pregnant with acupuncture and herbs alone, but many times we have to combine with Western medications. Sometimes it's as simple as they need some progesterone to start their cycle so that we can get their cycles back on track. Sometimes they may have to go farther because they aren't ovulating, and we can do treatments to help trigger ovulation, but sometimes their body needs a little push. The really exciting thing about going through acupuncture combined with Western medicine or alone and getting pregnant that way is many times after one pregnancy, the body kind of figures it out. And then once the couple wants to try again, if they do, a lot of my patients have gotten pregnant on their own. So just that whole working with the body, balancing it, and then the body knowing, oh, that's what I was supposed to do. Okay, let's do that again. And it works out great. There's a really great case study for that one. A patient who, really nothing wrong with either of them, nothing that could be found. Perfect body type, perfect, situation to get pregnant, under a lot of stress because fertility can be an incredibly stressful thing to deal with. However, she did go in and get a little bit of endometriosis removed, which sometimes the littlest bit can cause a problem. But as her doctor was looking around, she saw the vein supplied to her ovaries. And she goes, wow, those veins are really, really small, but they're pumping quite hard. And my patient said, I just came from acupuncture. She goes, oh, that makes sense. So finally, through a few rounds of assisted reproductive technology, we had to do IVF, so in vitro fertilization, and then combined with acupuncture, and then also doing a before and after treatment, it can be very, very successful. So a lot of times these success rates go from 20% to 60 to 70 when you're combining acupuncture and Chinese medicine.